We have a program that we are starting with your help. It's called IQM. It's called Integrated Quality Management. So that includes physician education, case manager education, resident education, all using the evidence-based guidelines from MCG, using your, optimal recovery guidelines, rapid review guidelines, or general recovery guidelines. So all these are being used to kind of process map best practices. So we're very excited about that. That's actually our newest charge from our senior leadership to say, we've done well on the back end. We want the front end fixed, but also we want the length of stay reduced and avoidable days and excess days reduced. So, like, that's a big lift. We need every bit of help we can get. So I turned immediately to MCG, and your folks have been very responsive in providing the support. So we were very successful with that denials process. So we went, because of the help we received, we got solid training from MCG, and we formed our own physician advisor group. And that's been the main success story that we have to tell today. And that was the focus of my talk today, is that we had a very scattered denials system in which, it was done by the hospitalists. And then we kind of took it away from them and formed our own physician advisor group, which grew from being me and two others to 22 strong. And right now we run 5 shifts a day with denials, and we've gotten pretty good at it over the last 20 months. We have 10x our volume of denials being contested. So we've gone from 170 denials being fought in a month to 1,170. And our turnover rate has gone from single digits to 34%, our, win rate. So that has kind of spurred the success, thinking, well, this kind of systematized approach, decreasing practice variation, standardizing it, and making sure that everybody's speaking the same language is very important. So that led to the development of IQM, which is the next step forward, which is looking at the front end, making sure we don't admit people we don't want to, finding alternatives to admission, and then the middle piece, which is the length of stay. So we kind of now working ourselves backwards. It's like the movie Memento. You start with a flashback, and then you go to the front and jump to the middle. So yeah, I always find that useful to compare. The nice thing is that these successes on the back end were big enough for senior leadership to realize that there is a huge value to standardizing the approach across the system, which is why I took the system role. And the system is now trying to find ways to make sure that all 7 sites are doing things the same way. And we don't have, a Monday style and a Thursday style, but we do it every day. And we want to staff up to 24/7 for every day of the week. That's another big ask, but it has to happen.